The flu season is coming soon, but this year it may be problematic due to the current global pandemic and the continued presence of COVID-19 infection, as most of the symptoms are comparable to influenza. Hi, my name is Dr. Amir, and welcome back to my YouTube channel. Many people think they have the flu when they actually have the common cold. The symptoms of common cold are runny nose, sore throat, and sneezing, which is a mild illness lasting for a few days. On the other hand, influenza symptoms are high fever, chills, body aches, headaches, and dry cough. It is a more serious infection that could last 1 week. The cause of the common cold and the flu are a different virus. However, the cause of COVID-19 is a new coronavirus, but it is very contagious. It can cause a mild infection in 85% of the cases, similar to influenza, except the presence of lack of smell and taste that could last for up to 2 weeks in COVID-19 infection. But in a small percentage, it can cause severe illness. The presence of fever this flu season may cause some concerns among patients and doctors because we have to differentiate between the two conditions. We normally diagnose influenza by either PCR test or rapid test. Both tests can show either influenza A virus, which is more common in adults, or B virus, which is common among children. What about the treatment for influenza? It is by rests, fluids, and medication to lower the fever, but not antibiotics. For severe influenza, we can give a medicine called Tamiflu, especially for children and elderly. Tamiflu might reduce the severity of symptoms, but also we can use it for patients' close relatives to prevent them from getting the flu. As you may know, there is no effective medicine to treat COVID-19 virus. Even antibiotics don't kill any viruses. But many patients start taking antibiotics on their own whenever they have fever or flu. This is wrong decision without doctor's advice. Of course, influenza and COVID-19 can cause pneumonia, which is a severe and sometimes deadly condition. But it is not very common in both illnesses. The good news is we can prevent the serious complications associated with influenza by taking the flu vaccine every year. Of course, we are all waiting for the anticipated COVID-19 vaccine. I see a lot of people decline taking the flu vaccine, while others think that they might get the flu from the vaccine. This is not true. The vaccine is made from an inactivated virus and will not cause the flu to happen. But occasionally, the flu vaccine, like any other vaccines, might cause a low-grade fever. So the flu vaccine is safe. It is normally available to be taken every fall. It is recommended for children over 6 months old, elderly, and patients with chronic medical conditions, and even to pregnant women, because they are at high risk for severe influenza. This is my advice for this flu season. If you have flu-like symptoms, especially fever, consult your doctor. We need to confirm which virus you have, not only for the sake of your health and safety, but for all other people around you. If it's COVID-19, you must quarantine yourself for 2 weeks to prevent its rapid spread. Finally, don't forget to take the flu vaccine soon. It will take 2 weeks to develop full immunity from the vaccine. Hopefully, it will protect you from getting the flu, but not from getting the common cold or COVID-19. I hope you enjoyed my topic today. To stay up to date with my latest videos, you can subscribe to my YouTube channel. Until I see you again, I would like to wish you a happy, healthy life.